Are you ready to be connected? You're listening to the Insured Connection podcast by Pica Group, a pro assurance company, where we provide expert advice for your practice when you need it most. We connect you with industry leaders to discuss timely topics so you can listen, learn, and get back to caring for your patients. Now, let's connect.
So hello, everyone. I'm your host, Dr. Adrianne Ross, and I have the privilege of, just introducing two very, very fine physicians that I have the privilege of working with at PICA, Dr. Krupa Patel and Dr. Katie Swanstrom, and they both have been working behind the scenes with PICA for quite some time now and regional leads in their respective territories. So thank you both for joining us.
Thank you.
Glad to be here, Adrianne.
Wonderful. So I wanted to kind of take this, we're using this more as a special episode to really dive down into more of the topic of, 2026, we've kicked off a new year, and what does that look like for podiatrists right now, as far as what is the ideal or the key characteristics, I would say, of a successful podiatrist in 2026? That comes up a lot with young physicians. And I'll start with you, Dr. Patel. What do you think? You deal a lot with residents as well.
Yeah, absolutely. I think success by definition is kind of what you expect as far as what your lifestyle is going to be, what you have as your goals for your future careers. When I talk to residents, the assumption is that every single doctor in the area is very successful. Everybody's doing well. And unfortunately, that may not be the case. I think what success means in 2026 is that we all are going to have to get really privy to numbers, what we're looking at. We have to become a little bit more business savvy. Private practice, which is what I'm in, is very different than it used to be. And being in practice now 16 years, I've seen every iteration and model that can exist in healthcare. And to stay competitive in a private practice and to be successful, you really need to have clarity. Like, you have to understand what your payer mix is, what are the services that are actually supporting the practice, and then, seeing this data, making decisions based on the actual numbers and not just, being emotional or, not having a strategy for growth. It's different than what we learn in training. And we definitely know quite a bit about the clinical knowledge, but what we really don't know is, like, what are margins, right? What can I change in order to be more successful? I think it's going to be a huge thing that our residents are going to really familiarize themselves with.
It's funny. I was just at a conference recently where the residents and the medical students were asking, well, how much money can I ask for? And using that as the only barometer for success. They weren't really asking a lot of other questions. So Dr. Swanstrom, I know that this comes up a lot as well, and even in leadership, kind of what are those metrics, but what are your thoughts on the topic?
Yeah, I think it's a challenging time that we're working and providing patient care in. We're getting squeezed from rising minimum wage to, payer mix isn't really covering our own costs sometimes. So I think that's really hard to attract and retain not only physicians, but also our staff, who can really make our lives a lot easier. So if you have a good, almost second family in your clinic, that makes life in general more enjoyable. And to me, was a marker of success when I generally liked the people that I worked with and we wanted the best for each other. To me, that was success. So I think it's a lot of how you frame success in your own life. And I agree that residents often look at just the money, but it's also how much do you have to work? Do you get reimbursed to take call? Like, how much are you churning your wheels and actually gaining from it rather than just being busy to be busy?
Yeah, I had an interesting conversation with a resident recently who said that, they thought that when they had more time to themselves, that would be a metric for success. And I actually have not come across too many young physicians or even residents or medical students who have even thought about that. Would you, either one of you, consider that for yourself and where you are right now in your career is kind of that buying back your time and how much time do you have to yourself, and the autonomy in that is a metric for success?
Yeah, I mean, absolutely. I think I would think, and what I've seen in some of our residents is that there's value. Success is defined not just by the financial, but there's also this work life, balance, I would say work-life integration that people are looking for, flexibility in their schedules, predictability for the most part, and time, right? So I would say 16, 17 years ago, it never really dawned on me that my time was going to be as important to me as it is now, right? Because my time was spent building a practice, being the person who was there all the time for all the call for every case and making sure not one patient was left behind in a way. Experience just being in practice, gives you this pattern recognition that you've seen issues, you've seen complications, you know what the market's going to do. Younger physicians maybe don't know that, right? So thinking about time is something you want to add in, but again, not to miss the forest for the trees, like you do want to be successful. So it does take time to build that. And I think some of that it's interesting because that's to me a package of success, right? If you're able to build a business and also have autonomy and ownership of that business and also be able to make your time yours, I mean I think that to me is a no-brainer. That's what I would want, and hopefully that's what I try to have now.
Same. So I'll ask the two of you, completely candid. When I was in residency or in fellowship, I don't really remember anyone harping on kind of this work-life integration or work-life balance. Nobody was asking me, how much time are you taking to yourself? Did either one of you ever even hear about that? When you were in training? I'll start with you, Katie.
No, I definitely didn't. I mean, I trained in highly surgical, high-paced trauma setting, and it was go, 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 patient first. I mean, to be honest, a lot of the physicians that I worked with had multiple marriages and weren't always the happiest people, and I wish the best for them, and I know that they brought what they could in the moment, but it definitely was not a priority to take care of yourself. It was take care of everybody else, and then if there's anything left over, then that's yours. But I think people now are more aware that you can't take care of others until you take care of yourself. So you have to make time for yourself.
Like what you're hearing? Go ahead and subscribe so you never miss an episode again. Now, let's continue to connect on today's topic.
Yeah, I agree 100%, Katie. I don't even think those words were ever strung together during my training. There was no such thing as post call. That's a new terminology that I've learned. I'm like, what does that even mean? And it's interesting because I'm the old person in the room now, generationally speaking. I'm like,
Oh,
these,
say that easy.
it is. You and I both, Adrian. Okay. But what ends up happening is, I have to put on a different lens when I am speaking to residents or even trying to understand where they're coming from. There's this concept of bridging the generations. Well, we're not that far apart, but we're miles apart on sort of the methodology that was used to train us, 15, 17, 18 years ago versus what's happening now. Now, I would say maybe 10 years ago, I was much more rigid in my thought process, right? Well, it has to be done this way. You're not going to learn unless you see all the cases. You have to be able to see all the things, all the pathology. But what I've sort of shifted my mindset to is that if I want to be impactful and our residents want to offer, amazing patient care, good quality care, and we're all on the same team. We're just going about it in a different way.
Mhm.
So demanding that, you spend 80 hours in a hospital and think it's okay is something that I've sort of restructured in my brain. Like, okay, it's not okay, right? And it's hard to admit that because I'm the old person in the room. Like when I was young, we walked in the snow with no shoes on. The whole mindset is very different.
We did do that. Come on.
We did. Come on. We're going to do it this weekend.
Exactly.
I mean, it's so different, because again, I work with a lot of residents. I do a lot of mentorship and I talk to people very candidly about what are you looking for? And, I don't think a lot of residents even know, right? They don't even have a concept of what's out there and what they're able to create as far as, entrepreneurship with a business, changing their practice style, going into a hospital. I don't even think they know. But yeah, I'm trying to be better.
Yeah. Yeah, that's funny. I don't hear that many people talk about it and just being okay with saying, "Hey, I don't know."
Yeah.
there's a plan, but I really don't know what I'm doing. And so you touched on kind of knowingly kind of where I want to go with this also, there does seem to be this intentional kind of movement towards bridging the gap between the young physicians and the more seasoned practitioners. I guess we're kind of more on the seasoned practitioners these days. What do you think the difference is as far as even the way that they view risk, between the two? And Katie, I'll start with you on that. Is there a difference in their perspective and the way they approach it?
Yes, I think there's a huge difference. I think that the people coming out are very risk averse when it comes to business mentalities. They don't necessarily want to be part of a private practice. They want the stability of a big system that gives them all the bells and whistles. And I think a lot of them don't realize how much flexibility and ownership of their own time that they're giving up with having to track RVUs and, be beholden to a big system. But at the same time, I think it's just a lot of risk aversion day to day. I mean, a lot of them grew up in the Great Recession, and so they don't like the idea of instability. They want a sure thing, and I think that's okay. It's just a big difference in how they look at things.
What about you, Krupa?
I definitely agree. They are risk averse when it comes to business models for sure. But if we think about this in the risk management lens of, are they doing riskier procedures, right? Are they doing more complicated cases? Is there something different inherently in what we do versus what we, meaning the seasoned, spicy attendings, right, versus our younger colleagues? Is there a difference? So I think one of the biggest changes over the last probably 15, 20 years is, a lot of the seasoned physicians trained in an era where the community respect was assumed, right? When you're being the doctor gave you this layer of protection. That ship has sailed. Today's patient questions everything, documents everything, and they're empowered to challenge their outcomes, right? So that alone has to shift everyone's management of risk, right? Risk when you're treating patients, offering surgery, doing all of those things. My hope is that our younger podiatrists come into this knowing that, right? Because generationally, they've had more access to information, quick information, right? So on the converse, younger podiatrists, they grew up on these like little sound bites, right? These short clips, the gotcha moments. I even say myself, who doesn't love a good infomercial, a little infographic, right? We love short bits of content. Now, that's a little bit dangerous because this is, there's this shallow risk awareness, meaning our younger podiatrists don't understand the depth of how to mitigate risk in a private practice or with their patients, but that patient relationships are actually very layered, emotional, complex. And there's no 30-second clip or YouTube short that's going to prepare you for that. So these younger podiatrists they're not less risky. They're just risky in a different manner, right? So that's one of the things when we talk about bridging the gap is, how do we demonstrate that to our younger podiatrists? How do we teach communication skills, right? That maybe were not core to their development, just because it was I call this the like, comment, and share generation, right? Everything is documented, photographed, videoed, and posted, right? I mean, I grew up in an era we had one computer PC and we signed on to AOL to have internet, right? I'm sure you ladies did the same.
Yes, I love AOL.
Yeah. We all had AIM. I mean, it was a whole different world, right? So much has changed. But have we really talked about risk management in sort of this new generation? And what does that mean? Like, how do we even mitigate risk?
It's funny. It's because I think, and I want to hear your thoughts on this, Katie, too, that the human component to it is something that can very easily be lost in the younger generation just because we're so, in tune with our devices. But Katie, what are your thoughts on that? From the human perspective and associated with risk.
Yeah, I think that, and when I say the younger generation, I want to clarify, it's not just podiatrists, because I'm the chief of staff at my hospital. So I see every single bad outcome and malpractice case that comes through for all the providers. And it's not just podiatry that's having this issue. It's every specialty. So I do think that the younger generation has a harder time with conflict, and they shut down very quickly if they feel like they've been insulted, or if they feel like they've hurt someone else. They just don't really have that interpersonal strength yet, I guess. And that's part of growing and learning. I mean, I just listened to a podcast that said the human brain doesn't stop developing until 32, which was way later than I had ever heard before. And I'm like, we're still learning how to do this when we're supposed to be the one with
Doing
the
it.
knowledge and, the one that everybody looks to fix their problems. And these residents are, under 30 and under typically. So they're still growing and learning and developing. And hopefully we all have the mentality that we continue to improve with our communication skills as we age. But it's definitely not something that we're directly taught, or at least I was not directly taught that in med school or in residency. So I think that's a big gap that we can target to help with risk mitigation, is just communication skills, especially when things go wrong or go sideways with complications or a difficult patient interaction.
Yeah, I think that there definitely is something to learn from the younger generation, and there's definitely something to learn from the more seasoned practitioners. I'll ask, for each of you, what would you say? Because when I think about it, the younger generation does seem to be very open to learning something new, whether it's AI or something else, and very easily just willing to do that, even on the surface level. Just willing to accept that. And I think that's a strength. And the seasoned generation, are used to kind of putting their hands on the problem without necessarily relying on anything else. They'll have that human connection. So as we're talking about bridging the gap, what would the two of you say, to our listeners as we try to bring those two together? Because we're all essentially rowing in the same direction. How can we learn from each other?
Think part of it is exactly what you just said. It's learning from each other. I don't think we can act like we have the golden ticket and know everything. Anytime we had an associate join, we learned from them their new techniques or the way they knew certain dot phrases or to build things in epic templates. So it was more of a communication and working together to make all of our jobs better. So I think if we can stay off of our high horse, then we can learn from them and they can learn from us. And it's not a us versus them mentality. It's everybody in it for the patient.
Yeah, I think that's a great point. I think podiatry in 2026 is really about mentorship in 2026, right? It's not going to be top down anymore. Our senior podiatrists, they can mentor on judgment, on surgical decision making and long-term thinking, business mindset. But I learned from our younger podiatrists because they're mentoring up on things that I don't know or don't understand, from technology, being creative about efficiencies, maybe things that I've never seen before, right? Never even thought of, and new patient expectations, right? They are the consumers that we are marketing to, right? This generation is who we want in our offices. I think if we are able to bridge this gap and create an exchange between our younger and our older, it's only gonna build respect and not create this sort of resentment. The old podiatrist always, they eat their young. This is the things we hear. But I think a lot of that generational friction comes really from the unspoken assumptions, right? Like older physicians are thinking, well, these younger ones really lack commitment. They just want time off, or they just don't want to be here. They don't want to work, right? Isn't that like the words we hear? We hear that in every field, right?
Buzzword, yeah.
And the younger physicians may think the older ones are trying to normalize burnout, right? And the buzzwords are, oh, they're gaslighting me, or I was triggered, I was this. And I think once you just hash it out and know that those words are just what they are, words, right? And our goal is a shared goal, right? One of being successful, well, one of great patient care, number one. Number two, being successful. And if you're in a private practice, making sure that that private practice can then stay open and running. And if that is what you really want, then you got to teach not just the why, but then the how, right? And a lot of the how with our older podiatrists is really just you live through situations and you learn from them, right? So there's just this experiential knowledge that you can't really Google. It's not.
Want to receive a monthly newsletter with topics from the Insured Connection? Head over to picagroup.com/Insured Connection and join our email list to have it delivered right to your inbox.
Something that is Googleable or chat GPTable.
And it's funny, there does seem to be a need to kind of practice the humility, whether you're a young practitioner or you're a more seasoned practitioner, that both of them call for that kind of being grounded and just that humility of being able to say, hey, I can learn from you, on both sides. And I think that's also that sets them up for success when it comes to risk, because as you both know, in the cases that we review, typically, is getting on the level of the patient and just being a human being, and being humble and accepting or saying, hey, there was a complication or something to that effect, and out of the respect for the other person. So that was really, really helpful, just what both of you had said. I think to close out, this conversation, because I do think that we'll probably have a follow-up because this is kind of triggering other questions, but what pearls would you say, and you can take one or the other, what pearls would you give to a young physician looking to be quote unquote successful, and also a little bit more open to being more risk aware? What pearls would you give to them, and what pearls would you give to a more seasoned practitioner at that phase?
Yeah, I'll start. I think firstly, I would say really sit down and think about the type of practice you want to have and what you enjoy seeing. Because when you are fresh out, you're usually not terribly busy. You have time to go market yourself and put yourself out there, do podcasts or radio shows or TV spotlights and say this is what I can do and what I like to do. And that's the type of patient that you'll attract. If you just take whatever you get, you don't know if that's the type of practice you wanted. And so I think it's like an intentional practice building that I would say is really important for young physicians to try for. And then I think the best way to avoid burnout, secondly, is to have a purpose and be intentional. Usually when people do get burnout, it's because they're not giving back. They don't know their why. They're not really involved in their community or mentoring people. When you have that purpose of building the profession, or say you like medical missions or whatever it is that fills your boat, know what that is and then seek that out. That would be my recommendations.
Great. Thank you.
So, as far as my recommendations, so I would say to a resident or a young podiatrist who's just come out into practice, I think level setting what your definitions of success are is that's going to be super helpful, right? One of the things I had to learn early is that my definition of success may not be Adrianne's definition of success. That may not be Katie's definition of success. And that's such a layered answer. And I say that because for me, success definitions have changed, right? When I came out of residency, it was very much a build volume, see a lot of patients, get my name out there, financial, right? That was really success. Great surgical outcomes, become board certified. Those were the things. But being able to change is huge, right? And recognizing that change in yourself. Success then was defined by, my family, my kids, and changing call schedules because I wanted to be at every baseball game. And, part of you, when you're in a rigorous field where taking call and doing surgery, middle of the night, gas gangrene, neck fash, part of you feels this sort of clawing at your soul, like you're doing something wrong because, Adrianne's definition of success is, putting on a frame at 2 a.m. Well, those are the things that I think residents really should give themselves some grace. It's okay to not want what everybody else wants, and working hard to get what you want is probably going to serve you better in the long term, right? And that could still change. For me, currently, I don't take any call because I don't want to, right? And I've set up a system where I don't need to, right? But that's a priority for me. That may not be a priority for everyone. So being intentional, writing those things down is going to ground you, to bring you back. When all the things are flying around you and trying to figure out, where do I go? What do I do? It's almost having a mission statement for yourself. At my practice, we have a mission statement. That's how we define what our goals are, not only for ourselves, but for our patients, right? The level and the type of care we want to offer. But having that mission statement is only going to make it better and easier for you to define success. And then as far as the second part of your question, Adrianne, after I went off about success, was bridging gaps and what's going to, go on, I guess, in the future. I think the big thing is, when we're thinking about risk management, right? I'd be 100% honest when I say I never thought that risk management was something I needed to worry about. That's not going to happen to me. I'm never going to get a lawsuit. I'm never going to have these issues. I'm amazing. I never thought that. My worst critic is me. So that's totally a lie. However, it's one of those, it's insurance, right? You only have insurance, you only use it when you need it. So you don't think about it. So the one piece of advice I would say is that risk awareness is a skill. And it's a skill that is a daily repetitive skill. It's like learning cursive. My kids are learning cursive now because it's back. Yay. If you don't use it, you lose it, right? And when we think about risk management, it's more than just doing the right surgery, right? The right way, right? It's more than that. It's about how you communicate, what type of expectations you're setting up for the particular patient. How did you document it? Are you being empathetic in your dealing of complications, right? Are you utilizing AI and not reading the note you're making? Are you doing things in a way that it's not that it's good medicine, but it's defensible medicine, right? Because this is the reality of the world we live in. You are going to get sued. If you operate, you will get sued, period. That's something we've heard across, the years and of different leadership at PICA, between Ross Taubman from Luke Ciccanelli. It's once every 20 years, there should be a lawsuit on your desk. And it's not that you're not a good surgeon, but it's that the law of averages says there's no way around it, right? So for me, I think the big thing is risk management, but risk awareness and really, really working on your communication skills and your ability to talk to people and empathize with people. And a lot of that goes back to, taking yourself off the high horse, right? Having humility and being kind to the people who are sitting in front of you, who are looking to you for the expertise. But that's all I got, Adrianne. I'm sorry.
Yeah. No, it's good. It's good. It's good. No, I thank you both for just being genuine and being authentic in the way of answering those questions, because I think that this is something that is important and that always lurks in the behind the scenes for all practitioners. And just looking at the profession from a 20,000 square foot view. So I appreciate you both with your experience and for your dedication to the profession, to be able to talk about these real life events and real life issues. So again, Dr. Patel, Dr. Swanstrom, thank you so, so much. And for all of our listeners, I look forward to you following us and listening to other conversations that we're having, because I imagine that they are quite pertinent to you. So again, Krupa, Katie, thank you again.
Absolutely. Thanks, Adrianne.
Thank you.
And that's it for this week's episode. But let's continue connecting. If you're enjoying the Insured Connection, don't forget to leave a review on your streaming platform and subscribe now so you can connect with us each time we post a new episode. To stay connected with us throughout the week and to tell us topics we should discuss on future episodes, go to picagroup.com/Insured Connection.